Yeah, the PADIT trial is a big multi-centre trial of assessing ways to reduce infection after device surgery, so after pacemaker and defibrillator surgery. So it randomised nearly 20,000 patients to a regime of standard antibiotics or incremental antibiotics, and looked at the incidence of device infection. But the main study was actually presented last year at these sessions, and the main study showed that with aggressive antibiotics you can reduce the risk of infection by about 23%. It didn't quite meet statistical significance. What we're presenting today is a follow-up study of the main PADIT study, where we tried to look at independent predictors of infection, and we managed to do that because we had lots of events, and we developed what we've called the PADIT infection risk score, which has never been done before, and we came up with a 5-variable score that will tell us or tell a physician or a doctor and a patient what the risk of an infection is before they decide whether to go ahead with the procedure. Device infection is very serious. It's not like other infections. It's much more serious because of the obviously the hardware inside the patient. So if a patient gets infected with a device, everything has to come out. So it's got a mortality associated with it. That's why we take it so seriously. Yeah, well, we managed to find 5 independent predictors. These were the type of procedure, meaning the lowest risk was pacemaker, the highest risk was more complex device surgery. The second predictor was the number of procedures you'd had previously done at your device site. Number 3 was age. Age was very interesting. Actually, it goes in the opposite direction. The younger you are, the more likely you are to have an infection. Immunocompromise was number 4, and number 5 was renal dysfunction. So you put all that together and you get this risk score. You plug in a patient's variable, and at the low end of the scale, if you've got 0 points in the scale, for example, your risk of infection is 0.3%, whereas if you're at the upper end, 7 or more on the scale, your risk of infection is 3.5, 4.5, 5%. And those are, ranges where patients probably will decide not to have the surgery. Well, the C statistic of the score is 0.7, so it's a pretty good, robust score compared to other clinical scores that are already in use. For example, the CHADS-VASc score has got a lower C statistic, so I think it's ready for clinical use. I think we've already started to use it in our own institution. We're going to use it in 2 main ways. Number 1, if a patient's at very high risk of infection, we're going to give them additional antibiotics and possibly use the Tyrex envelope as well. But number 2, especially for older people or patients who've got a real choice to make, it's going to be very important information to say, the benefits of this procedure is X, the risk of infection is Y, and if you get an infection, it's going to be serious. You're going to be in hospital for an average of 30 days with this infection. So I think it's going to be very clinically useful. Yeah, no, ideally what we would want to see, and I think it will happen, is that the scoring system will be validated in a second population. So the Danish pacemaker registry and ICD registry, people have already approached us to do that. So I think that's going to be the next step. It's also going to be useful. The score is going to be very useful for future clinical trials. You can imagine a situation where your inclusion criteria of a future trial will include the PADIT risk score. So patients only at very high risk of infection, and that means if you enrich your population like that with a higher event rate, then you need fewer patients for your clinical trials. So I think those are going to be the next steps.